Good morning, guys. Good morning, Ashish. Good morning, Mugundan. Good morning, Moha and Soumya. Good morning. Fine. So, I hope yesterday's session was useful. And good morning, Anashwara. Good morning. And yesterday they would have conducted a small test on this. How was the test? How do you did it? Whether it was useful, whether you were able to attend the questions. So uh, yesterday I got some feedbacks that I was going some little bit fast. So I'll try to uh, I'll try to curtail myself. Okay, so I'll try to cut down the speed. We'll go a little bit slow today, and we'll try to cover a lower limb and some part of the abdomen. Okay, so almost on half of the abdomen we'll try to cover today, and tomorrow we'll be seeing about the rest of the abdomen and the head and neck session. Okay, so without wasting much of the time in the morning, we'll go to the today's session just on lower limb. Okay, see, before going into the lower limb, we'll just see you a few important things related to the osteology of the lower limb, and then we'll proceed to the regions of the lower limb. Okay, so to highlight in you, first we'll see about the osteology of the hip bone. Okay, osteology of the hip bone. Okay, fine. So if you take the hip bone has got the following parts, guys. It has got the following parts. Okay, fine. Yes, Ashish. Okay, so we'll see about the osteology of the hip bone. See, if you see the hip bone is also called as what? It is also called as innominate bone. Okay, it is also called as innominate bone. Okay, this innominate bone has got three parts in it. It has got three parts in it. Okay, one part is called as the ilium, the other part is called as the pubis, and the third part is called as ischium. Okay, fine. So these three bones join to form a bone called as the hip bone. And when you look into the hip bone has got two surfaces. Okay, it has got two surfaces. One is called as the pelvic surface, another one is called as a gluteal surface. So there are two surfaces for the hip bone. One is called as a pelvic surface, another one is called as a gluteal surface. So if you see the pelvic surface of the hip bone, okay, so it has got the following parts. Okay, so you see there is a bony projection anteriorly. This bony projection is called as the anterior superior iliac spine. This is called as anterior superior iliac spine, guys. This is called as anterior superior iliac spine. When you trace the anterior superior iliac spine behind, it forms the iliac crest. Okay, it forms the iliac crest. Anterior iliac spine, if you go 5 centimeter behind, you get an elevation. Okay, so this elevation which you get at 5 centimeter behind the anterior superior iliac spine is called as what? It is called as the iliac tubercle. This is called as iliac tubercle or iliac tuberosity. So what is it? It is present 5 centimeter behind the anterior superior iliac spine, and this is called as iliac tubercle. What is called? This is called as iliac tubercle. So next is the iliac tubercle continues as the iliac crest, and it finally ends at the posterior superior iliac spine. It ends in the posterior superior iliac spine. When you trace the hip bone anteriorly, the anterior superior iliac spine continues as the anterior border of the ilium and ends in anterior inferior iliac spine. So what is this? This is anterior inferior iliac spine. Okay, so just we'll add few points here. Anterior superior iliac spine, okay, and anterior inferior iliac spine. You get a muscle which is attached to anterior superior iliac spine, that is called as sartorius. This is called as sartorius. And a muscle which is attached to the anterior inferior iliac spine, or the muscle takes origin from the anterior inferior iliac spine. So if somebody asks you, where does sartorius arises from, what is the origin of the sartorius? Okay, so what is the origin of the sartorius? You can say that sartorius arises from the anterior superior iliac spine. Okay, and from the anterior inferior iliac spine you get a muscle called as a straight head of rectus femoris. Straight head of rectus femoris arises from the anterior inferior iliac spine. So guys, remember, From the anterior superior iliac spine, one muscle arises, and from the anterior inferior iliac spine also one muscle arises. Here you have a ligament which is attached to the anterior superior iliac spine, that is called as a inguinal ligament. This is inguinal ligament, and the ligament which is attached to the anterior inferior iliac spine is called as the iliofemoral ligament. It is called as the iliofemoral ligament. Okay, so if you want to compare anterior superior iliac spine and anterior inferior iliac spine, you have got one muscle attached here, that is called as sartorius, and you have got another muscle attached at the anterior inferior iliac spine, that is the straight head of rectus femoris. What is the ligament which is attached to anterior superior iliac spine? That is the inguinal ligament. And what is the ligament which is attached to anterior inferior iliac spine? That is the iliofemoral ligament. I hope you know iliofemoral ligament is a ligament of the hip joint. Iliofemoral ligament is a ligament of the hip joint. When we come across the hip joint, we will see about this ligament in detail. Okay, so if you trace the picture, you get the anterior inferior iliac spine. From the anterior inferior iliac spine, the ilium bone becomes an eminence, that is called as iliopubic eminence. So what is this eminence called as? This eminence is called as iliopubic eminence. This is called as iliopubic eminence. This is called as iliopubic eminence. And when you trace the iliopubic eminence, it becomes a superior ramus of the pubis. Okay, so this is called as the superior ramus of the pubis. This is called as the superior ramus of the pubis. So we are coming to the pubic bone now. So this is called as the superior ramus of the pubis. The superior ramus of the pubis continues as the body of the pubis. Okay, so what is this? This is called as the body of the pubis. This is called as the body of the pubis. Okay, so if you see the superior ramus of the pubis, it presents a small elevation, and this elevation is called as what? This elevation is called as a pubic tubercle. This is called as pubic tubercle. Okay, what is this? This is called as pubic tubercle. Medial to the pubic tubercle, you have the part of the superior ramus which is called as the pubic crest. So this is called as a pubic crest. Okay, so these are all certain parts of the pubic bone. So we are tracing the ilium. So ilium starts from the anterior superior iliac spine, then it becomes the anterior inferior iliac spine, then an elevation is seen, that is called as iliopubic eminence, which continued at the superior ramus of the pubis. In the superior ramus of the pubis, you can see a tubercle which is called as pubic tubercle, which is called as pubic tubercle. Okay, so now if you trace the body of the pubis becomes the inferior ramus of the pubis. It is called as the inferior ramus of the pubis. It is called as the inferior ramus of the pubis. It is called as the inferior ramus of the pubis. And this inferior ramus of the pubis continues with the ischium as conjoint ischiopubic rami and forms a ischial tuberosity. So what is this? This is called as the ischial tuberosity. This is called as ischial tuberosity, guys. This is called as ischial tuberosity. Okay, and what is this rami where the ischium and the pubis fuses? It is called as conjoint. It is called as conjoint ischiopubic rami. It is called as conjoint ischiopubic rami. It is called as conjoint ischiopubic rami. Okay, now you get a foramen here. Okay, now you get a foramen here. So can anybody tell me what is this foramen called as? What is this foramen, guys? You get a foramen below the superior ramus of the pubis, and what is that foramen called as? Yes, good morning, guys. Yes, Mugundan, very good. It is obturator foramen. Excellent, guys. It is obturator foramen. So this foramen is called as obturator foramen. Okay, this foramen is called as an obturator foramen, and this obturator foramen is covered by a membrane. Okay, it is covered by a membrane. Okay, so there is a membrane which covers this obturator membrane, not completely, but almost 2/3 of it is covered by a membrane called as obturator membrane. Okay, this is called as obturator membrane. Okay, so you see a gap between the superior ramus of the pubis and the obturator membrane. Okay, so you see a gap here. So what is this gap? Can anybody tell me what is this gap called as, guys? What is this gap called as? So there is a gap between the superior ramus of the pubis and the obturator foramen and the obturator membrane. So what is that gap called as? It is called as the obturator foramen. Okay, so this is called as obturator foramen. Okay, and can anybody tell me what is the structure that passes through the obturator foramen, guys? Anybody? What is a nerve that passes through the obturator foramen? Yes, the nerve that passes through the obturator foramen is the obturator nerve. That is very, very simple. It is the obturator nerve. Very good. Very good, Anashwara. It is the obturator nerve. Okay, so we have done with the pubis, and we have end with the ischium. Okay, ischium has got a tuberosity called as ischial tuberosity, has got a tuberosity called as ischial tuberosity. Okay, so this ischial tuberosity is the point where you sit and work. When you sit on the table, okay, when you sit on the table, it is this ischial tuberosity which comes in contact with the ground level. Okay, so what happens is, if you sit for a very longer time, when you sit for a very longer time, you have a bursa here, you have a bursa here. So this ischial bursa can get inflamed. Okay, so there is a bursa here. This bursa is called as what? This is called as ischial bursa. This is called as ischial bursa. So if you sit for a long time and when you do work, this ischial bursa can get inflamed. Okay, so it can get inflamed. So inflammation of the ischial bursa, okay, inflammation of the ischial bursa results in ischial bursitis, which is called as Weaver's bottom, which is called as Weaver's bottom. So you know weavers, the function of the weavers, you know, they sit for a very long time and they do their work. So when they sit for a longer time and when you sit on a hard couch, this ischial bursa can get inflamed. Okay, this ischial bursa can get inflamed, and the inflammation of the ischial bursa can result in a condition called as ischial bursitis, which is called as Weaver's bottom, which is called as what? Which is called as Weaver's bottom. Yes guys, it is called as Weaver's bottom. Fine. So this is the importance of ischium there. Okay, now if you see okay, so if you see the pelvic bone again, okay, so when we trace the iliac bone, it had ended in a spine called as posterior superior iliac spine. So this is called as posterior superior iliac spine, and this posterior superior iliac spine ends in posterior inferior iliac spine. So this is called as a posterior inferior iliac spine, and from the posterior inferior iliac spine you get a big notch. Okay, so this notch is called as the greater sciatic notch. So this is called as what? This is called as greater sciatic notch. This is called as greater sciatic notch, and this greater sciatic notch ends in a spine, and this spine is called as ischial spine. So what is this spine called as? This is called as ischial spine. Okay, this is called as ischial spine, and this ischial spine ends in a notch called as the lesser sciatic notch. So this is called as lesser sciatic notch. This is called as lesser sciatic notch, and this lesser sciatic notch continues as the ischium bone, and this lesser sciatic notch continues as the ischium bone. Okay, so these are all the things you see from the pelvic surface of the hip bone, guys. So pelvic surface of the hip bone has got another marking, which is called as an linear terminalis or an arcuate line. So when you trace the superior ramus of the pubis, you get a line here. Okay, you get a faint line here. Okay, so this line divides the pelvis into an false pelvis above and a true pelvis below. Okay, so this line is called as an arcuate line. This is called as an arcuate line. Okay, so this line divides the pelvis into false pelvis above this line and the true pelvis below this line, and the true pelvis below this line. Okay, so this is about the pelvic surface or the inner surface of the hip bone. Okay, when we come to the outer surface of the hip bone, okay, so again you can see the posterior superior iliac spine ending in the anterior superior iliac spine here. The anterior inferior iliac spine is here. Okay, the posterior inferior iliac spine is here. Okay, so what is this? This is the gluteal surface. So this is the gluteal surface of the hip bone. This is the gluteal surface of the hip bone. What are the things you see here? What you see here is the iliac crest. What you see here is the iliac crest. What you see here is the anterior superior iliac spine. What you see here is the anterior inferior iliac spine. What you see here is the posterior superior iliac spine, and what you see here is the posterior inferior iliac spine. This is posterior inferior iliac spine. So you are seeing the gluteal surface. This posterior inferior iliac spine, as we have already seen, it continues as the greater sciatic notch. This greater sciatic notch is seen here. So this is called as greater sciatic notch. And this greater sciatic notch ends in a spine called as ischial spine. So what is this spine? This is called as ischial spine. Okay, there is an important nerve which winds around the ischial spine like this. Can anybody tell me what is the nerve there are three structures, but I just want to highlight only one structure here. An important nerve winds around the ischial spine. An important nerve winds around the ischial spine. Can anybody tell me what is this nerve called as? Yes, there are three structures. Yes, guys, it is pudendal nerve. Very good. Pudendal nerve is the important. There are three structures. We will discuss about the other structures later. So there is an important nerve called as pudendal nerve, which winds around this ischial spine. Okay, which winds around the ischial spine. Okay, fine, guys. Oh, so this ischial spine, if you trace the ischial spine, this ischial spine then continues as a small notch called as a lesser sciatic notch. This is called as a lesser sciatic notch. This is called as a lesser sciatic notch. Okay, and this lesser sciatic notch continues as the ischium bone. So this is the ischium bone. So you can see the ischium bone clearly in this view rather than in the anterior view or in the pelvic view. So gluteal surface, when you see, you can see the ilium bone very well. So this ilium bone has got a body. So this is called as the body of the, this is called as the body of the ischium. Okay, and you get a tuberosity. This is called as the ischial tuberosity. This is called as the ischial tuberosity. Okay, and when you trace the ischium bone, it forms the conjoint ischiopubic rami. This is called as the conjoint. This is called as a conjoint ischiopubic rami. This is called as conjoint ischiopubic rami. Okay, this is called as conjoint ischiopubic rami. And when you trace the anterior inferior iliac spine, it continues below the iliopubic eminence, and the hip bone is formed by the completion of the pubic bone here. Okay, so this is how the hip bone is formed. So what is this? This is the pubic bone which you see here. This is the pubic bone which you see here. Now what is the difference between the gluteal surface and the pelvic surface? When you look into the gluteal surface, okay, so you get an important cup here. You get an important cup here. Okay, so this cup which is present here is called as the acetabulum. It's called as the acetabulum, guys. So what is this? This is called as acetabulum, an important part of the hip bone, because acetabulum is the one which forms the hip joint. Okay, it is the one which forms the hip joint, guys. So acetabulum is seen here. Acetabulum is seen here. Clear? Now from the greater sciatic notch, okay, from the greater sciatic notch you can draw three lines, guys. Okay, so from the apex of the greater sciatic notch you can draw three lines. Okay, so the three lines are one is called as an inferior gluteal line, inferior gluteal line. One is called as an anterior gluteal line. Next one is called as an posterior gluteal line. So you can draw three lines. Okay, so one is called as an anterior, one is called as an inferior gluteal line. Next is called as an anterior gluteal line, and next one is called as an posterior gluteal line. So this divides the ilium into four areas: area number 1, area number 2, area number 3, and area number 4. We will see what is these areas and what are the things that are related to these areas in a short while. Okay, so when you see the greater sciatic notch, from the greater sciatic notch you can see the lines which are traversing. They are faint lines. Okay, sometimes not much visible clearly. So these lines are called as, one is called as an inferior gluteal line, next is called as an anterior gluteal line, and then is called as an posterior gluteal line. So this divides the gluteal surface of the ilium into four areas. Okay, into four areas. Okay, so we'll see what are these areas and what are the things that are related to these areas. So if you see the hip bone, the ilium articulates. Okay, the ilium articulates with the bone on the posterior side. Okay, so this bone which articulates with the ilium is called as a sacrum bone. This is called as what? This is called as a sacrum bone. This is called a sacrum bone, and the joint which is formed here is called as an SI joint or the sacroiliac joint. Okay, so sacroiliac joint. Okay, sacroiliac joint. If I talk about sacroiliac joint, the only one thing which strikes me is sacroiliac joint inflammation results in sacroiliitis. It results in sacroiliitis. Okay, it results in sacroiliitis. Sacroiliitis, when it happens in one common condition called as, anybody guys, that starts with the letter A? Sacroiliitis. Very good. It's seen in ankylosing spondylitis. It is seen in ankylosing spondylitis. It is seen in ankylosing spondylitis, which is an seronegative type of, inflammatory disorder. It is a seronegative inflammatory disorder of the joints. Okay, it is a seronegative inflammatory disorders of joint. So there is a test called as pump handle test, there is a test called as pump handle test, and there is a test called as Ganselan test to clinically test sacroiliitis. So these are certain clinical tests for sacroiliitis. One is called as a pump handle test, then there is a test called as Ganselan test. Okay, then there is a test called as Faber test. All these tests are clinical tests to find about sacroiliitis. Sacroiliitis is the classical feature of an inflammatory condition called as ankylosing spondylitis. It is the classical feature of ankylosing spondylitis. Okay, so to add one more point here, okay, so ankylosing spondylitis will have this positive, this test will be positive, that is HLA-B27 will be positive. Okay, HLA-B27 will be positive. Okay, HLA-B27 will be positive in the case of sacroiliitis, in the case of ankylosing spondylitis. Okay, so just to add a few things, I am just giving certain inputs here related to orthopedics, so I am not going to the details of ankylosing spondylitis. Okay, now if you see the posterior side of the hip bone, you see two important ligaments, guys. You see two important ligaments. One ligament extends from the sacrum and from the ilium bone to the ischial tuberosity, and this ligament which is extending from the sacrum and from the ilium to the ischial tuberosity is called as the sacrotuberous ligament. This is called as the sacrotuberous ligament, guys. So this is called as what? This is called as sacrotuberous ligament. This is called as sacrotuberous ligament. Okay, this is called a sacrotuberous ligament. And when you take the sacrum, okay, when you take the sacrum, there is another ligament which extends from the ischial spine to the sacrum. Okay, so this ligament which is seen from the ischial spine to the sacrum is called as the sacrospinous ligament. This is called as sacrospinous ligament. Okay, this is called as sacrospinous ligament. So you should know about these two ligaments here. One is called as the sacrospinous ligament, which is horizontally oriented. Another one is vertically oriented, that is called as the sacrotuberous ligament. Okay, that is called as sacrotuberous ligament. So sacrotuberous ligament, okay, helps in providing vertical stability for the pelvis. Okay, vertical stability for the pelvis is provided by sacrotuberous ligament. Sacrospinous ligament provides rotational stability for the pelvis. It provides a rotational stability for the pelvis. Okay, so it provides a rotational stability for the pelvis. Okay, fine. So I hope you are clear with this. Okay, guys. Yes, so we have seen about the parts of the hip bone. Okay, so we have seen the two surfaces. First we have discussed about the pelvic surface of the hip bone, and then we were discussing about the gluteal surface of the hip bone. These are all the important things to be noted here. Okay, so always remember, guys. Okay, pelvic bone. Okay, pelvic bone when it gets fractured, it results in lot of hemorrhage. Okay, it can result in lot of intra-pelvic hemorrhage. So approximately 2 to 2.5 liters of blood loss can happen. It can cause 2 to 2.5 liters of blood loss within the pelvis, which cannot be seen outside. Okay, so pelvic fractures are more prone for intra-pelvic hemorrhages, intra-pelvic hematoma. Almost 2 to 2.5 liters of blood can be lost in pelvic fractures. Okay, so there is a classification system for pelvic fracture which is called as Stiles classification. This is called as Stiles classification. So for pelvic fracture, the classification system is Stiles classification. Okay, and always remember there is another important socket here which is called as acetabulum. So acetabular fractures are classified by a classification system called as Judet and Letourneur classification. Judet and Letterman classification. So you should know the name of this classification. That is more than enough. If somebody asks you what is the classification system for acetabular fracture, you can very well say it is Judet and Letterman classification. And for pelvic fracture, it is Stiles classification. Okay, mostly whenever there is an acetabular fracture, acetabulum forms a joint, so these fractures are usually intra-articular fractures. These fractures are usually intra-articular fractures. Guys. Okay, so this is about the hip bone. Okay, with this basis, we'll go to the next bone in the thigh region, which is again an important bone to understand the further parts of the hip and the thigh region. Okay, so the next bone what you see here is the femur bone. Okay, what you see here will be the femur. So the femur bone is one of the strongest bone in the body. Femur bone is one of the strongest bone in the body, and it is one of the longest bone in the body. Okay, so femur bone, if you take, these are all the parts of the femur bone. Okay, so femur bone has got a spherical structure proximally. This is called as the head of the femur. This is called as the head of the femur. This is called as head of the femur. Next, below the head of the femur, you get the neck of the femur. And if you trace the superior aspect of the neck of the femur, it forms a projection called as the greater trochanter of the femur. This is called as the greater trochanter of the femur. And when you trace the greater trochanter of the femur, it continues as the lateral part of the shaft of the femur. When you trace the inferior aspect of the neck of the femur, it forms a projection here. This is called as a lesser trochanter of the femur. And when you trace the lesser trochanter of the femur, it becomes the medial side of the shaft of the femur. Okay, so this is the proximal femur anatomy. When you look from the anterior aspect. So if you look from the anterior aspect, you have got greater trochanter laterally and lesser trochanter posteromedially. These two are connected by a faint line anteriorly. This line is called as the intertrochanteric line. This line is called as an intertrochanteric line. Can anybody tell me what is attached to the intertrochanteric line? Okay, so you are seeing the anterior view of the femur. When you see the anterior view of the femur, you see a line running between the greater trochanter and the lesser trochanter. And can anybody tell me what is attached to the very good Anashwara, very good. So it is the attachment of the capsule of the hip joint. So capsule of the hip joint is attached to the intertrochanteric line. So what is attached here? It is the capsule of the hip joint which is attached here. Very good. Okay, so it is the capsule of the hip joint which is attached here. Okay, see from the capsule, okay, after the capsule gets attached to the intertrochanteric line, this capsule gets reflected. Okay, this capsule gets reflected over the neck of the femur. Okay, it gets reflected over the neck of the femur like this. These fibrous reflections from the capsule over the neck of the femur are called as the retinacular fibers. So these are called as the retinacular fibers. These are called as the retinacular fibers. Okay, so these are the things you must know when you look into the proximal part of the femur. Okay, when you look into the proximal part of the femur from its posterior. So what is this view? This is the proximal femur. What view it is? This is the anterior view of the proximal femur. And also guys, remember, in the head region, okay, you get a small depression, guys. Here, the small depression which you see in the head region, this small depression is called as what? Anybody, guys? So what is the small depression called as? Yes, anybody? Yes, Anashwara, Soumya, Monisha. Guys, what is the small depression in the yes, Mugundan, very good. It is called as fovea capitis. It is called as what? Fovea capitis. And can anybody tell me what is the structure that is attached to the fovea capitis, guys? Yes, these are all MCQ, guys. These are all questions which have come in the previous year exams. Very good, Anashwara. So there is a ligament which is attached here. There is a ligament which is attached here. The ligament which is attached to the fovea capitis is called as a ligamentum teres. This is called as ligamentum teres, or the ligament of head of femur. So that is called as ligament of head of femur. So what is this ligament called as? This ligament is called as ligamentum teres. Okay, this is called as ligamentum teres, or also called as ligamentum of head of femur. Now next important question is, what is a vessel which runs through the ligament of head of the femur? Okay, so there is a vessel which runs through the ligament of head of the femur. Can anybody tell me what is the vessel which runs here? The vessel which runs here is the artery to the head of the femur, which is a branch of obturator artery, So what is this artery? This artery is a branch from the obturator artery to the head of the femur. So these are the things you should know from the anterior aspect. So when you see the femur from the posterior aspect, guys, so I am just drawing the posterior view of the proximal femur. Okay, so when you see the posterior aspect of the proximal femur, okay, so again you see the head of the femur like this. Okay, so you can see the neck of the femur. Okay, you can see the trochanter, greater trochanter. Okay, you can see the greater trochanter. Okay, and you can see the lesser trochanter nicely when you see the posterior side. So this is very important point, guys. When you see the posterior aspect of the femur, you can able to see the lesser trochanter clearly, because lesser trochanter is a posteromedial structure. So when you see from the posterior side, you can able to see the lesser trochanter very clearly. Now when you see the posterior aspect of the proximal femur, there is a thick crest which runs in between the two trochanters. And this crest is called as intertrochanteric crest. Now what is this crest? This crest is called as intertrochanteric crest. This is called as intertrochanteric crest. And now can anybody tell me what is the structure which is attached to the intertrochanteric crest? What is the structure? My question is otherwise, does the capsule of the hip joint is attached to the intertrochanteric crest? Anteriorly we saw the capsule is attached to the intertrochanteric line. Okay, posteriorly, does the capsule of the hip joint is attached to intertrochanteric crest or not? So that is the question for you guys. So does the capsule of the hip joint is attached to the intertrochanteric crest or not? Yes, guys. So anybody from the audience side, guys, does the capsule gets attached to the intertrochanteric crest? No, the answer is no. The capsule is attached. Okay, the capsule is attached. Very good, Anashwara. The capsule is attached medial to the intertrochanteric crest. It is attached medial to the intertrochanteric crest. Okay, it is attached medial to the, so this is the line of capsule, this is the line of capsule attachment, and it is not attached to the intertrochanteric crest. So please remember, anteriorly the capsule is attached to the intertrochanteric line, but posteriorly the capsule is not attached to the intertrochanteric crest. Now when you trace the posterior part of the lesser trochanter below, okay, when you trace it below, this lesser trochanter continues below as a thick line here, and this thick line is called as the pectineal line. Now what is this line called as? This line is called as the pectineal line. Okay, so the name itself tells you this pectineal line will receive the insertion of pectineus muscle, and when you trace the greater trochanter below, this greater trochanter forms a thickened ridge here. This is called as a gluteal tuberosity. What is this called as? This is called as a gluteal tuberosity. And when you trace the femur, okay, when you trace the femur below, okay, so when you trace the femur below to its shaft, these thickenings continues as a thickening in the posterior aspect of the femoral shaft. Okay, and this thickening which is seen on the posterior aspect of the femoral shaft is called as linea aspera. So what is this called as? This is called as linea aspera. So in the posterior aspect of the So in the posterior aspect of the femoral shaft, you get a thickened area. This area is very, very important. This area is called as linea aspera. This area is called as what? This is called as linea aspera. Okay, so these are the important things you should know about the femur. In the proximal femur, these are the important things you should know. So whenever you see the femur, okay, so these important points should catch your mind. We will see the attachment of the various parts of the femur in a short while when we come to the muscles. But to understand the basis of the regions around the hip joint, these are the must know area. Okay, now we'll go into the femoral triangle. Okay, now we'll go to the first region of the today's session, that is femoral triangle. Okay guys, yes, femoral triangle is a very, very well known question. You would have written several times this question in your first year exams. Okay, so where is femoral triangle located? Femoral triangle is located in front of the thigh. Okay, it is present in front of the thigh. Okay, it is present in front of the thigh. This femoral triangle is also called as Scarpa's triangle. This is also called as Scarpa's triangle. Okay, it is present in the front of the thigh in the upper part. Okay, it is present in the front of the thigh in the upper part. Okay, it is an inverted triangle. It is an inverted triangle in shape. It is an inverted triangle in shape. Okay, it is an inverted triangle in shape. It has got a base above. Okay, since it is an inverted triangle, the base is above, and the base is formed by the inguinal ligament, guys. So the base is formed by the inguinal ligament. Okay, so you can see the inguinal ligament stretching from the anterior superior iliac spine to an elevation here, which is called as a pubic tubercle, So this is the point of attachment of the inguinal ligament. Inguinal ligament on one side, it is attached to anterior superior iliac spine, and on the other side it is attached to pubic tubercle, and this forms the base of the inguinal ligament. Okay, if you take the femoral triangle, okay, so the femoral triangle has got the following boundaries. So the base of the femoral triangle is formed by inguinal ligament. Okay, you can write it. It is called as inguinal ligament. Okay, now when you see the medial boundary, okay, so the medial boundary of the femoral triangle is formed by the lateral. The medial boundary of the femoral triangle is formed by the medial border of adductor longus muscle. It is formed by the medial border of adductor longus muscle. So what you see here is the adductor longus muscle, guys. So what you see here is the adductor longus muscle. Okay, so this adductor longus muscle has got two borders. One is called as the medial border. So this is called as a medial border. Okay, this is called as a medial border. And what you see here is the lateral border of the adductor longus. Okay, since adductor longus also forms a part of the floor, okay, if it is also forming a part of the floor, the boundary of the inguinal or the femoral triangle is by the medial border of the adductor longus. So that is why they have written medial border of the adductor longus. Okay, that is why they have written medial border of the adductor longus here. So medial boundary is by the medial border of the adductor longus. And what is the lateral boundary? The lateral boundary is by the medial border of the sartorius. Again, it is by the medial border of the sartorius. And what is the apex? Apex is the point where both this muscle meet. Okay, apex is the point where both this muscle meet. So when you take the femoral triangle has got a base, it has got a medial boundary, and it has got a lateral boundary. And I hope from the diagram it is very clear what are all the things that forms the boundaries of the femoral triangle. Now when you see the femoral triangle is covered in its top portion, or we simply call it as a roof of the femoral triangle. Okay, so the roof of the femoral triangle contains, okay, skin. Okay, you all know that when you reflect the skin, then you get the superficial fascia. Okay, you get the superficial fascia. Running in the superficial fascia will be the saphenous vein. And surrounding the saphenous vein, you got superficial inguinal lymph nodes. Okay, so all these are present in the roof of the femoral triangle. Next comes the deep fascia. Okay, so deep fascia gets modified around this a femoral vein to form a fascia called as cribriform fascia. So there is a fascia which is formed here. It's a modification of deep fascia called as cribriform fascia, which is called as cribriform fascia. So the roof of the femoral triangle is formed by skin. It is formed by superficial fascia and by deep fascia, and this deep fascia is in the form of a cribriform plate-like appearance over the femoral vein, and that fascia is called as cribriform fascia. So this forms the roof of the femoral triangle. Now coming to the floor of the femoral triangle, when you see the floor of the triangle, already we have seen one part of the floor, that is the adductor longus. So the next muscle which you see here, which is forming the floor, will be the pectineus muscle. So there is a muscle lateral to the adductor longus. This muscle is called as pectineus muscle. So what is this muscle, guys? This muscle is called as pectineus muscle. Okay, so pectineus muscle, if you talk about pectineus muscle is an hybrid muscle. Okay, it is called as an hybrid muscle. Okay, what do you mean by hybrid muscle, guys? Anybody? What do you mean by hybrid muscle? So whenever a muscle is supplied by two different set of nerves, it is called as an hybrid muscle. And can anybody tell me what are the two nerves which supplies the pectineus? Yes, so pectineus has got dual nerve supply, guys. And can anybody tell me what are the two nerves which supplies the pectineus muscle? Yes, so one is called as a femoral nerve, okay, and the other nerve which supplies the pectineus is the obturator nerve, is the anterior division of the obturator nerve. So two nerves supplies a muscle. When two different nerves supplies a muscle, that is called as hybrid muscle. There are a lot of hybrid muscles in the body. Can anybody tell me one more example for hybrid muscle? Yesterday we saw these muscles. Anybody? One more example for an hybrid muscle, guys. Flexor digitorum profundus. Excellent, guys. Flexor digitorum profundus. And yes, Dolphin and Mugundan, can anybody tell me what is the nerve supply for flexor digitorum profundus? Flexor digitorum profundus nerve supply. Yes, guys. Flexor digitorum profundus nerve supply. It is very easy. Yesterday we saw about that. Medial half, lateral half. The medial half is supplied by, very good, it is supplied by ulnar nerve, and it is also supplied by the anterior interosseous nerve. Very good. So this is again an hybrid muscle. Similarly, you have got another muscle called as brachialis. Okay, brachialis has got okay, Vashisha, I think now it is clear. Yes, fine. So hybrid muscle. Okay, so we are talking about the hybrid muscle. Brachialis muscle is again a hybrid muscle. It is supplied by two nerves. One is called as musculocutaneous nerve, and the other nerve which supplies brachialis is the radial nerve. Okay, yesterday we didn't saw about this. So now you can add this to the radial nerve in the arm. It also supplies a muscle called as brachialis muscle. So brachialis is an example for hybrid muscle. I will tell you one more example for hybrid muscle, that is called as the adductor magnus muscle. Okay, that is called as adductor magnus muscle. Yes, adductor magnus muscle has got two nerve supplies. One is the obturator nerve, which supplies the adductor part, and the hamstring part is supplied by the sciatic nerve. So these are few examples in the body where you can see hybrid muscle. So hybrid muscles examples are pectineus, flexor digitorum profundus, brachialis, adductor magnus, and you should also know about the nerve supply of these muscles. Okay, so with this background, we'll go to the femoral triangle back again. So the floor of the femoral triangle is formed by these muscles. The next muscle which forms the floor of the femoral triangle, which is almost tendinous in this area. So this is the psoas tendon. Which fuses with the iliacus muscle to form the iliopsoas tendon here, So what is this? So these two things represents the iliopsoas tendon. It is the iliopsoas tendon which is forming the floor of the femoral triangle, So we can write it here. So where they have given a picture here. Yes, femoral triangle floor. Okay, so femoral triangle floor, if you see from the medial side to the lateral side, Okay, so don't see the things which are given here, just you can tell me what is this number 1 represents. This number 1 represents the adductor longus muscle. Yes, it represents adductor longus muscle. 2 represents the pectineus muscle. 2 represents the pectineus muscle. 3 represents the psoas muscle. Okay, psoas muscle or psoas major muscle, psoas major muscle. And the 4 represents the iliacus muscle. It is the iliacus muscle. It is the iliacus muscle. So these are the muscles which forms the floor of the femoral triangle. Okay, so now you saw that femoral triangle. This femoral triangle, it's an inverted triangle which is present in front of the thigh, in the upper part of the thigh. It is also called a Scarpa's triangle. It has got a base, it has got a medial boundary, it has got a lateral boundary, and it has got an apex where these two boundaries meet. We have seen about the roof of the femoral triangle, and we have seen about the floor of the femoral triangle. Okay, so next is the contents of the femoral triangle. So we have seen about various areas of the femoral triangle. Now we are going to the contents of the femoral triangle. Okay, so what are all the contents you see in the femoral triangle? Okay, in the femoral triangle you will see an important artery which is running, which is called as a femoral artery, which is called as a femoral artery. So there is an artery which is running here, which is called as a femoral artery. Okay, femoral artery and its branches are seen, okay, in this femoral triangle. Okay, femoral artery and its branches are seen. Next you will see the femoral vein. Next you will see the femoral vein and its tributaries. And its tributaries you will see here. Femoral vein and its tributaries you will see here. Next you will see a node called as the deep inguinal lymph node. Okay, you can see deep inguinal lymph nodes here. You will see deep inguinal lymph nodes here. Okay, you will also see, okay, so you will also see important nerve in the femoral triangle, that is called as a femoral nerve. That is called as a femoral nerve. Apart from the femoral nerve, you will also see one important nerve here, that is called as a lateral. That is called as a lateral femoral cutaneous nerve of the thigh. Lateral femoral cutaneous nerve of the thigh. That also you will see in the large or lateral part of the femoral triangle. So that is called as lateral femoral cutaneous nerve of the thigh. Okay, so these are all the main contents in the femoral triangle. These are all the main contents in the femoral triangle, guys. Okay, so when you see this content, the content what you see on the lateral aspect, the lateral femoral cutaneous nerve of the thigh, it runs very close between the inguinal ligament and the ischial spine. I hope you know what is this spine. This is called as anterior superior iliac spine, and this is called as a inguinal ligament. The green color represents the inguinal ligament. Now if you see here, you will see a nerve which is running close to this area. Okay, so this nerve which is running between the inguinal ligament and the anterior superior iliac spine on the lateral most part of the femoral triangle is called as the lateral femoral cutaneous nerve of the thigh. This is called as lateral femoral cutaneous nerve of the thigh. Okay, and it is more prone for compression in this area, and it is more prone for compression in this area. Yes, very good, Yani. It is called as myalgia parasitica. Okay, so if you see this picture, that is what they have given in the first part. So you can see the lateral femoral cutaneous nerve of thigh getting compressed close to the inguinal ligament results in an paresthesia over the lateral aspect of the thigh. So you will have paresthesia. You will have paresthesia over the anterolateral aspect of the thigh, or the anterolateral aspect of the thigh, or the anterolateral aspect of the thigh, you get an paresthesia. Okay, and this condition is called as myalgia paresthetica. This is called as myalgia paresthetica. Okay, this is called as myalgia paresthetica. All this comes under a group of syndromes called as entrapment neuropathies. They comes under a group of condition called as entrapment neuropathies. I hope you know there is another condition called as chiralgia paresthetica. Chiralgia paresthetica. Okay, I think there is no need to tell about it. Yesterday we have discussed about it. Anybody what is called as chiralgia paresthetica? Which nerve compression is called as chiralgia paresthetica? Yes. Which nerve compression is called as chiralgia paresthetica? Yes, guys, I am waiting for your answer, guys. Yes, very good. It is the sensory branch of radial nerve, which is called as a superficial branch of radial nerve, which is called as a superficial branch of radial nerve, which is called as a superficial branch of radial nerve. Okay, this is called a superficial branch of radial. Very good, guys, excellent. So this is due to compression of the chiralgia. This is due to compression of the superficial branch of radial nerve around the wrist region. When you tie wrist watches very tightly here, that can cause numbness on the dorsum of the first wave space, that can result in a condition called as chiralgia parasitica. So we were discussing about the femoral triangle, and we have seen about the contents of the femoral triangle. So these are all the contents of the femoral triangle. Okay, so if you see the contents of the femoral triangle, okay, this is what the contents of the femoral triangle are. So what you see here is the lateral femoral cutaneous nerve of the thigh. So what you see here is the lateral femoral cutaneous nerve of the thigh. This is called as lateral femoral cutaneous nerve of the thigh. And what you see here is the femoral nerve. Okay, so this is the femoral nerve. This is the femoral nerve. Okay, this is femoral nerve. And just medial to the femoral nerve, you get an artery. This artery is called as a femoral artery. This artery is called as a femoral artery, and this femoral artery gives a deep branch here. So the deep branch what you see here, okay, so the deep branch what you see here, okay, so this is the deep branch which is arising from the femoral artery, and the deep branch what you see here is called as a profunda, femoris artery. This is called as profunda femoris artery. This is called as profunda femoris artery. From the femoral artery you get 3 superficial branches which are seen here. The one superficial branch what you see here is called as the superficial external pudendal artery. This is called a superficial external pudendal artery. Okay, it goes to the genital regions. This is called a superficial external pudendal artery, and what you see here is called as a superficial epigastric vessels. This is called as a superficial epigastric vessels. This is called a superficial epigastric vessels, and a vessel which is running to the iliac region. This is called a superficial circumflex. This is called a superficial circumflex iliac artery. This is called a superficial circumflex iliac artery. Okay, so these are all the superficial branches which you see in the femoral triangle, which are all branches of the femoral artery, guys. So what are all the superficial branches? One is superficial epigastric artery. Okay, so this is the superficial epigastric artery. Next is the superficial external pudendal artery. So this is the superficial external pudendal artery. The third is going to the anterior superior iliac spine region. This is called a superficial circumflex iliac artery. This is called a superficial circumflex iliac artery. And also remember, guys, there are certain deep branches which are given here. The first deep branch what you see here is the profunda femoris artery. Which is a deep branch. You can also see one more deep branch here. So the deep branch which you see here is nothing but the deep external pudendal artery. This is called as deep external pudendal artery, which again goes and supplies the testicular and the scrotal region. This is called as deep external pudendal artery. This is called as deep external pudendal artery, which is again a deep branch. So the green color box represents the deep branches of the femoral artery. So these are all the important contents. So whenever you see the vessels, okay, always the arteries are accompanied by the veins. Okay, you can see the corresponding veins accompanying the superficial branches, but the take home message here is, when you see the vessels, these vessels are branches of the femoral artery. Okay, these vessels are branches of femoral artery, whereas these veins are tributaries of anybody, guys. These veins, the corresponding veins, here you can see a vein, here you are seeing a vein, and here you are seeing a vein. All these superficial veins are tributaries of this vein. Okay, so the vein which you see here is called as a saphenous vein. Okay, so the tributaries of all these are tributaries of this vein. This is called as saphenous vein. Great saphenous vein. Excellent, Charu, excellent. So all these veins are tributaries of saphenous vein, great saphenous vein. Very good. So they are all tributaries of great saphenous vein. Okay, so please remember, the arteries are branches of femoral artery, but the veins accompanying them are not tributaries of femoral vein. Okay, so this you should understand, they are not tributaries of the femoral vein. They are instead, they are tributaries of the great saphenous vein. Okay, and this great saphenous vein opens into the femoral vein by passing through a fascia in the deep fascia. That fascia is called as cribriform fascia. So you get a fascia here, which is in the form of a cribriform plate-like structure. So this fascia, what you see here is the cribriform fascia. So the great saphenous vein, pierces the cribriform fascia. The great saphenous vein pierces the cribriform fascia and drains into the femoral vein. Okay, so these are all the important contents to be noted here. Okay, so the last content which is present on the medial side, is the lymph node here. With the lymph node here, so you get a lymph node, okay, in this region. So this lymph node which is present medial to the femoral vein is called as a deep inguinal lymph node. This is called as deep inguinal lymph node, which is also called as lymph node of Cloquet. So what is this lymph node, guys? This lymph node is called as a deep inguinal. This is called as a deep inguinal lymph nodes. This deep inguinal lymph node is also called as the Cloquet node. It is also called as a Cloquet node. Okay, it is also called as a node of Rosenmuller. It is also called as node of Rosenmuller. It is also called as node of Rosenmuller. Anybody, guys? Deep inguinal lymph node drains. Okay, this is an important question. It's an important MCQ question. Deep inguinal lymph node drains the glans penis. Yes, very good, Dolphin. It drains the glans penis. It drains the glans penis in the males, and it drains the clitorius in the females, and it drains the clitorius in the female. Glans clitorius and glans penis are drained by the deep inguinal lymph nodes, guys. Deep inguinal lymph node is also called as, guys, deep inguinal lymph node is also called as Cloquet lymph node, also called as nodes of Rosenmuller. See, if you see the contents of the femoral triangle, guys, okay, so these contents of the femoral triangle are enclosed in a sheath called as femoral sheath. Okay, they are not lying naked here, they are covered by a sheath called as the femoral sheath. So if you want to understand the femoral sheath, okay, which we are going to see next, okay, you should understand an important orientation here. So we'll just draw a simple orientation of the abdomen and the thigh. Okay, we'll just draw a simple orientation. So when you look from the sides, so when you make a sagittal section, of the femoral triangle region, and when you look from the sides, this is what you see. Okay, so if you see the sagittal section, as you all know, the abdominal skin, okay, is continuous with the skin of the thigh region. Okay, and I hope you all know, deep to the skin you got the superficial fascia. Okay, so in the abdomen you don't have deep fascia. The superficial fascia is in two layers: superficial fascia of Camper and the deep membranous layer of Scarpa. Okay, so in the abdomen you got the superficial fatty layer. Okay, you got the superficial fatty layer of Camper. It is called as a superficial fatty layer of Camper, and deep to the superficial fatty layer you get a membranous layer. This membranous layer is called as the Scarpa's layer. I hope you know this, guys. This is called as Scarpa's layer. And this is what? This is a deep membranous layer. Both are part of superficial fascia. In the abdomen. In the abdomen there is nothing called as deep fascia. The superficial fascia is of two types. One is a superficial fatty layer of Camper and the deep membranous layer of Scarpa. Okay, this is about the coverings in the abdomen. So when you trace these coverings, the fatty layer continues as the superficial fascia. Of the thigh also. What is interesting is you have to know about this muscle which is deep to the Scarpa's layer. Can anybody tell me what is the first layer of muscle in the abdomen? Okay, what is the first muscle you see when you go from anterior? Okay, you open the skin, you open the superficial fascia. What is the first muscle you will encounter, guys? The first muscle you encounter is external oblique muscle. Very good, guys. The first muscle you encounter is external oblique abdominis muscle. So this external oblique abdominis muscle is the first muscle you encounter here. When you trace the external oblique abdominis muscle down, okay, when it comes to the inguinal region, this external oblique abdominis muscle become an aponeurosis and it gets bent by itself and forms a ligament, and this ligament is called as the inguinal ligament. So what is this muscle, guys? This muscle what you see here, is the external oblique, it is the external oblique abdominis muscle, it is the external oblique abdominis muscle, and this external oblique abdominis muscle bent down and forms a ligament, and this ligament is called as what? This ligament is called as inguinal ligament. So what is this ligament called as? This is called as inguinal ligament. I am not going to talk about the inguinal ligament now, just you have to understand inguinal ligament is formed by the aponeurosis of external oblique abdominis muscle. This is very important, guys. So inguinal ligament is formed by the lower aponeurotic part of the external oblique abdominis muscle. Okay, it is formed by the lower part of the external oblique abdominis muscle. So that is inguinal ligament. Now I hope you know that there is a fascia in the thigh region, the deep fascia in the thigh region, which is also called as fascia lata, which goes and gets inserted into the inguinal ligament, which also goes and gets inserted into the inguinal ligament. Okay, so where is the fascia lata getting attached? The fascia lata is going and getting attached to the inguinal ligament. So what is this fascia, guys? Yes, so this fascia which is here is the deep fascia, of the thigh region. This deep fascia of the thigh region is also called as what? It is also called as fascia lata, which is also called as fascia lata. And what is the layer which is standing alone there? So the layer which is standing alone is the deep membranous layer of scarpa. It is not attached to the inguinal ligament. Instead, it enters the thigh and it gets attached to the fascia lata. Okay, can you able to understand this, guys? So where is the superficial or the deep membranous layer is attached? The deep membranous layer is not attached to the inguinal ligament. Instead, it enters the thigh, it enters the upper part of the thigh, and it is attached to the fascia lata. This point of attachment is called as Holden's line. So this is called as what? This is called as Holden's line. Okay, fine, guys, please remember, very important point. If you want to understand the urethral rupture, if you want to understand the bulbar urethral rupture, if you want to understand the membranous urethral rupture, if you want to understand after bulbar urethral rupture where all the urine can get collected, this point is very important. When we come to the urethra, we will talk about this once again, but what I want to understand here is the deep membranous layer enters the thigh region and it is attached to the inguinal, it is attached to the fascia lata, and the point of attachment of the deep membranous layer and the fascia lata is called as Holden's line. Is called as what? It is called as Holden's line. Now since we have discussed about Holden's line, I just will give you another line. I will see, just can anybody tell me what is this line present or where it is present? Can anybody tell me where is Hilton's line present? White line of Hilton. Can anybody tell me where is white line of Hilton present? We have seen about the Holden's line. Where is white line of Hilton's present? Guys, anybody, guys, from the students, guys? Yes, can anybody tell me where is white line of Hilton's present? It is in yes, very good. Yes, it is anal canal. Very good, guys, it is anal canal. Okay, it is anal canal. Very good. Okay, so can anybody tell me, is there anything related to Hilton's line, right? Like Hilton's, is there anything related to Hilton's in anatomy? There is a law called as Hilton's law. You know that there is a law called as Hilton's law. Okay, there is a law called as Hilton's law. Okay, so can anybody tell me what is called as in Hilton's law? Okay, so I hope you know if there is a joint, the joint is covered by a muscle and the muscle is covered by a skin. Okay, I hope you know that Hilton's law means. So you should know that there is a joint. If there is a joint, the joints are covered by muscle and the muscles are in turn covered by skin. So what does Hilton's law says is, okay, if a nerve supplies a muscle, okay, it will also supplies the joint on which the muscle acts, and it will also supply the skin over the joint. Okay, so what does Hilton's law supplies? Hilton's law says, when a nerve supplies a joint, okay, when a nerve supplies a joint, it will also supplies the muscle acting on the joint and the skin covering the joint. That is called as Hilton's law. I will give a classical example for Hilton's law. Okay, one such example is axillary nerve. Okay, one such example is axillary nerve. Axillary nerve supplies the shoulder joint. Axillary nerve supplies the shoulder joint. Axillary nerve supplies the deltoid muscle which act on the shoulder joint. Axillary nerve supplies the skin over the deltoid region. Axillary nerve supplies the skin over the deltoid region. Axillary nerve supplies the skin over the deltoid region. Okay, guys. So Hilton's law, the axillary nerve is one nerve which obeys Hilton's law. There is one more nerve which also obeys Hilton's law, that is nerve to vastus medialis. Nerve to vastus medialis also a nerve which is seen in the thigh which also obeys the Hilton's law. Okay, so white line of Hilton you saw in the anal canal. Hilton's law, you should remember about Hilton's law. What is Hilton's law? If a nerve supplies a joint, it will also supplies the muscle acting on the joint, and it will also supplies the skin covering the joint. It will also supplies the skin covering that area. Okay, so that is called as Hilton's law. Okay, come back. So this is called as Holden's line. So we were discussing about Holden's line. So the next muscle layer what you see in the abdomen, the next muscle layer what you see in the abdomen is the internal oblique abdominis muscle. So what is this muscle? This is internal oblique abdominis muscle. This is called as internal oblique abdominis muscle. And the next muscle what you see here, the next muscle what you see here is the transverse abdominis muscle, is the transverse abdominis muscle. Okay, so this muscle also gets attached to the inguinal ligament. Okay, so this muscle is called as the transverse abdominis muscle. So this muscle is called as transverse abdominis muscle. This is called as transverse abdominis muscle. Okay, so deep to the transverse abdominis muscle there is one interesting fascia which is called as fascia transversalis. There is a fascia called as fascia transversalis. So there is a fascia called as fascia transversalis. There is a fascia called as fascia transversalis. So these are the important structures in the anterior abdominal wall. Okay, so in the anterior abdominal wall, when you go from outside to inside, you first get the skin, then you get the superficial fatty layer which is called as the superficial fatty layer of Camper. The next layer is called as the deep membranous layer of Scarpa. Deep to the deep membranous layer of Scarpa, you get the muscles. So the first muscle what you see in the abdomen is the external oblique abdominis muscle. Important point regarding external oblique abdominis muscle is this muscle turns down to form a ligament, and that ligament is called as the inguinal ligament. That ligament is called as the inguinal ligament. Deep to the external oblique abdominis muscle, you got the internal oblique abdominis muscle and the transverse abdominis muscle getting attached to the inguinal ligament. Deep to it is the fascia transversalis. Okay, this fascia is very important. So this is called as fascia transversalis. This is called as fascia transversalis. Okay, now when you go to the posterior part of the abdominal wall, you have a muscle called as iliacus muscle. You have a muscle called as iliacus muscle. Okay, so this iliacus muscle, okay, this iliacus muscle is coming to the thigh region and it is getting attached to the lesser trochanter. So this iliac muscle is covered by a fascia called as fascia iliaca. So it is covered by fascia called as fascia iliaca. I will use a different color. So I will just use a different color. So this is called as fascia iliaca. So what is this muscle called as, guys? This muscle which you see here is the iliacus muscle. This is called as the iliacus muscle, and the fascia covering the iliacus muscle is called as fascia iliaca. It is called as fascia iliaca. Now running in between these two areas are the contents of the abdomen, and the contents of the abdomen can enter into the thigh region through a space between the inguinal ligament and the pubic bone. Okay, so between the inguinal ligament, so if you see this space, through this space the contents of the abdomen can enter, and one such content which enters from the abdomen into the thigh is the femoral artery. So this is what this artery is called as the femoral artery. This artery is called as femoral artery. This artery is called as femoral artery. And if you see the femoral artery, the upper 3 to 4 centimeter, upper 3 to 4 centimeter of the femoral artery is covered by the fascia transversalis and by the fascia iliaca So the femoral artery, which is covered by the fascia transversalis anteriorly and by the fascia iliaca posteriorly, is called as the femoral sheath. Now what is this sheath represents? So this sheath represents a sheath called as femoral sheath. This represents a sheath called as femoral sheath. Okay, I hope you understood what is called as femoral sheath. So femoral sheath is formed on the anterior part by fascia transversalis. Okay, so if you take femoral sheath, guys, okay, femoral sheath, what is femoral sheath? Femoral sheath is a fascial sheath which covers the proximal, 3 to 4 centimeter of the femoral vessels. Okay, 3 to 4 centimeter of the femoral vessels. Okay, and it has got two layers. One is called as an anterior layer, another one is called as an posterior layer. So these are the layers of the femoral sheath. So it has got two layers. As we have seen from the diagram, anterior layer is formed by fascia transversalis. It is formed by fascia transversalis, and the posterior layer is formed by the fascia iliaca. Okay, it is formed by the fascia iliaca. Okay, so it is formed with the fascia iliaca. So the femoral sheath is not equal on both the sides. Okay, if you see the femoral sheath here, okay, the femoral sheath is longer on the lateral side. And it is shorter on the medial side. Okay, it is shorter on the medial side. So it has got an anterior layer and it has got an posterior layer. Okay, now within the femoral sheath you got certain compartments. Now what are all the compartments in the femoral sheath? Okay, so now coming to the compartments of the femoral sheath. Okay, compartments of the femoral sheath are 3 in number. Okay, compartments of the femoral sheath are 3 in number. Okay, one is called as a medial compartment. Okay, medial compartment is a compartment where you get the deep inguinal lymph node. Okay, deep inguinal lymph node. So it is the compartment where you get the deep inguinal lymph node. The intermediate compartment is the area where you get the femoral vein. Guys, it is the area where you get the femoral vein. And the lateral compartment is the structure or is the area which contains the femoral artery, and along with the femoral artery, the lateral compartment also contains one nerve, okay, which supplies the skin over the femoral triangle. Okay, that nerve is called as the femoral branch of genitofemoral nerve. That branch is called as a femoral branch of genitofemoral nerve. Okay, so that branch is called as a femoral branch of genitofemoral nerve. Okay, guys, clear? So if you see the compartments within the femoral sheath, there are 3 compartments. Okay, so what you see here are the 3 compartments. The medial compartment is the compartment which contains this node. So this is the deep inguinal lymph node. Okay, this is the deep inguinal lymph node. Okay, the intermediate compartment contains this vein. This vein is called as the femoral vein. Okay, this vein is called as the femoral vein. And the lateral compartment, what you see here, contains the femoral artery. It contains a femoral artery, and along with the femoral artery you can see there is a nerve which is running, and the nerve which is running here is not the femoral nerve, but it is the femoral branch of genitofemoral nerve. So what is this nerve? This nerve which is running here is the femoral branch of genitofemoral nerve. It is the femoral branch of genitofemoral nerve. Now you can ask me, sir, there is one more important content which was present in the femoral triangle. Okay, I can able to see this important content here, sir, but I am not able to see it here because femoral nerve is not a content of femoral sheath. It lies outside the femoral sheath. It is not a content. It lies outside. Okay, it lies outside. Okay, this is not a content. So please remember, guys, femoral nerve. Okay, femoral nerve is not a content of femoral sheath. Okay, so this is very important. Not a content of femoral sheath. So this is about the femoral sheath and its content. Of this, the very important compartment or the most talked compartment in exams is the medial compartment. Okay, so though the medial compartment contains only a small lymph node, why it is so important? Okay, so this medial compartment is leading into a small space here, and this space what you see here is called as a femoral canal. So what you see here, so I'll just mark it in yellow color so that you can easily see here. This is called as a femoral canal. This is called as femoral canal, and this femoral canal is bounded, okay, is bounded on the superior aspect by a ring called as a femoral ring. So what is this ring called as? This is called as a femoral ring. This is called as femoral ring. So if you take the femoral canal, which is the medial compartment of the femoral sheath, it is bounded by a ring. It is bounded by a ring, and this ring is called as a femoral ring. What is this ring called as? This ring is called as a femoral ring, guys. This ring is called as femoral ring. So please remember, the femoral ring boundaries are very important. If you want to understand the femoral ring boundaries, you need to look from the inferior aspect. Okay, you need to look from the inferior aspect, so that when you look from the inferior aspect, you can easily see the femoral ring. Okay, you can easily understand the boundaries. So for that we have given this orientation. Okay, for that we have given this orientation. Okay, so if you see here, what are the structures? First you see this is called as the inguinal ligament. Okay, this is called as the inguinal ligament. Okay, this ligament is called as an inguinal ligament, and this inguinal ligament gives rise to certain reflections. Okay, this reflection of the inguinal ligament, what you see here, this reflection of the inguinal ligament, what you see here, okay, is called as the lacunar ligament. So what is this ligament? This is a reflection of the inguinal ligament. This is called as a lacunar ligament. This is called as a lacunar ligament. Okay, so this ligament is very important in understanding the femoral ring again. So this ligament is called as the lacunar ligament. And what is this structure? You see here, this structure what you see here is the femoral artery, and what you see here is the femoral vein. What you see here is the femoral vein. Now as you all know that the femoral artery and femoral vein are within the femoral sheath. They are in the intermediate and in the lateral compartment, and this compartment what you see here, okay, this compartment what you see here is the medial compartment. This is the medial compartment, and this medial compartment, okay, contains a node, and this node is called as the cloaquet node. This is called as the cloaquet node, and this canal is called as the femoral canal, which is bounded by a ring in its topmost portion. This part which is surrounded by a ring is called as a femoral ring. Now if you see the boundaries of the femoral ring, okay, if you see the boundaries of the femoral ring, the anterior boundaries of the femoral ring, okay, so this is the anterior boundary of the femoral ring, which is formed by the inguinal ligament. You see a muscle here. So this muscle is called as pectineus muscle. What is this muscle called as? This muscle is called as pectineus muscle, and you get a fascia which covers over the pectineus. You get a fascia which covers over the pectineus. So that fascia is called as a fascia covering the pectineus, which forms the posterior boundary of the femoral ring. And on the medial side, you get this ligament. This ligament, you know that this ligament is called as lacunar ligament, which forms the medial boundary. And on the lateral boundary, you get a septum which separates the intermediate and the medial compartment of the femoral sheath. Okay, so what is this ring? This ring is called as the femoral ring. We'll just see what are the boundaries of the femoral ring now. So femoral ring, okay, femoral ring is bounded anteriorly. It is bounded anteriorly by the inguinal ligament. It is bounded anteriorly by the inguinal ligament. What you see here, yes, so this ligament is the anterior boundary. So this ligament is the anterior boundary. So the anterior boundary is by the inguinal ligament. Posteriorly you see a muscle. This muscle is called as pectineus, and this pectineus is covered by fascia. This fascia is called as a fascia. This fascia is called as a fascia covering the pectineus muscle. Fascia covering the pectineus muscle. Okay, and on the medial side there is a reflection of the inguinal ligament. So this reflection on the inguinal ligament on the medial side is called as a lacunar ligament. And laterally, okay, you get the septum. Okay, you get the septum separating. Separating the medial and the intermediate compartment. So these are all the boundaries of the femoral ring. Okay, so why do you want to know about the femoral ring? What is the importance of femoral canal? So if you want to understand that, okay, you should understand this femoral canal can lead to an hernia. Okay, so sometimes the contents of the abdomen can come into this canal, so this hernia is called as an femoral hernia. See, you know that femoral canal is a small space, and if the femoral hernia happens, if it is a small space, it can easily go in for what, when the viscera comes out, and if it comes out through a narrow region, if the area is tight, this hernia can go into what, okay, it can go into strangulation. Very good, Priya, it can go into strangulation. Now if a femoral hernia has happened, if it goes in for strangulation, if the bowel wall goes in for ischemia, then you can easily land up in perforation and peritonitis. So in order to avoid that, you need to reduce the femoral hernia. Okay, you need to reduce the femoral hernia. Now how to reduce the femoral hernia? If you want to reduce the femoral hernia, okay, so what happens here, just see, through the femoral canal, through the femoral canal you can have the herniation, which is called as femoral hernia, so if you want to reduce the femoral hernia surgically, you need to enlarge the femoral ring. Because it is very tight there. If you want to enlarge a femoral ring, what structure you can cut? The best structure to cut is, you have to cut the lacunar ligament. To enlarge the femoral ring. So you can cut it here. Okay, so you can cut here and you can enlarge the femoral ring. There is no problem in it. But sometimes guys, please remember, but sometimes an abnormal obturator artery can be seen here. So what is this? Sometimes when you cut here, okay, if there is an abnormal obturator artery, and if you cut it, then it can result in severe bleeding. Okay, so when you try to reduce the femoral hernia, when you try to enlarge the femoral ring, this is the one important structure you should keep in mind, because normally the obturator artery does not runs in this area. If there is a branch which runs on the lacunar ligament side, we call it as an abnormal obturator artery. So when an abnormal obturator artery runs in this, when you cut the lacunar ligament, you can inadvertently cut the abnormal obturator artery, resulting in profuse bleeding or severe bleeding. Okay, so this is an take home message for femoral ring. So if you want to understand the femoral ring, this view will help you in understanding the femoral ring. Okay, I hope you understood what is the femoral triangle. Okay, I hope you understood what is the femoral triangle. Guys, I think my video is not working. Okay, yes, I think my video is not working. Yes, we'll just wait for a second. Okay, I think there is an technical issue. We'll just wait for a second. Okay, so we were discussing about the femoral triangle. In the femoral triangle, we have also seen about the femoral sheath, and in the femoral sheath we have seen about the femoral ring, which is very important. Okay, which is very important. Okay, so femoral ring can lead to femoral hernia. So when you are going to reduce the femoral hernia, you are going to cut the lacunar ligament. Sometimes an abnormal obturator artery can run on the lateral border of the lacunar ligament. So when you cut the lacunar ligament, you can inadvertently cut it, and it can result in profuse bleeding. So that is what we saw. Okay, so we were discussing about the femoral ring and the femoral hernia. So to conclude the topic, the last thing is, if you see the femoral ring is not a completely open ring. Okay, it is surrounded by extraperitoneal tissue here. Extraperitoneal fat pad will be covering this. Okay, so this extraperitoneal fat pad which is covering the femoral ring is called as the femoral septum. This is called as femoral septum. Guys, this is called as femoral septum. Okay, so these are the important things in the femoral triangle, guys. So please remember, only one carry-on message is femoral nerve is not a content of the femoral sheath. Femoral nerve is not a content of the femoral sheath. Okay, so these are all the important take home messages from the femoral region. So before going into the thigh, okay, just two more things. Okay, so if you have tenderness, okay, if you have tenderness in the Scarpa's triangle, okay, if you have tenderness in the Scarpa's triangle, what are all the possibilities where you can get tenderness in the Scarpa's triangle? See, Scarpa's triangle is basically femoral triangle. So if you get tenderness in the femoral triangle, so there could be chances of neck of femur fracture. There can be chances of head of femur fracture, or there can be a dislocation. There can be a hip dislocation. In all these conditions, you can get tenderness in the Scarpa's triangle. Okay. So with this clinical note, we'll go to the next muscle of the thigh, that is quadriceps femoris muscle. Okay, so see, if you want to study the quadriceps femoris muscle or any muscle in the lower limb region, it is always better to draw a simple cross section and understand the orientation of the muscle, so that it is very easy to understand the origin and insertion of the muscle. See, what I'm going to do is I'm going to make a cross section of the thigh here. Okay, so when I make a cross section of the thigh, you all know that the outermost covering of the body will be the skin. Okay, so this is the skin of the thigh region. And deep to the skin of the thigh region, you all know that, okay, so there is an a fascia here. So this is the superficial fascia which is present on the inner aspect, of the skin. Deep to the skin, you get the superficial fascia. Now deep to the superficial fascia, you get the next layer, which is called as the deep fascia. This is called as the deep fascia. Okay, so the deep fascia of the thigh is called as what? The deep fascia of the thigh is called as the fascia lata. So what is this? The deep fascia of the thigh. Deep fascia of the thigh is called as fascia lata. It is called as fascia lata. Okay, it is called as fascia lata. Now when you see the fascia lata, various septums goes from the fascia lata to the bone and divides the entire thigh into various compartments. So if you see in the center of the thigh region, you get the bone. What does this bone represents? This bone represents the femur bone. So this bone represents a femur bone. Okay, this bone represents a femur bone. This is the anterior side of the thigh. This is the posterior side of the thigh. This is the medial side of the thigh, and this is the lateral side of the thigh. Okay, this is the medial side of the thigh, and this is the lateral side of the thigh. See, whenever you see the posterior side of the femur, in the posterior side of the femur, you get a thickening here. Can anybody tell me what is the thickening here, guys, which is seen on the posterior surface of the femur? What is the thickening which is seen on the posterior surface of the femur called as? Anybody, guys? We saw this thickening in the earlier sessions. So you get a very good anashvara. So you see a thickening on the posterior aspect of the femur. So this thickening is called as what? This is called as linea aspera, and this linea aspera has got two lips. It has got a lateral lip, it has got a medial lip, and it has got a groove in between, and this lips and the groove gives attachment to various intermuscular septas and the muscles in this area. So if you trace the deep fascia of the thigh, so the deep fascia of the thigh, what happens is it comes and gets attached to the lateral lip of linea aspera. Okay, it is getting attached to the medial lip of linea aspera, and it is also attached to the intertubercular, or the groove between the two lips of the linea aspera. Okay, now if you see the entire thigh, because of the attachment of these septas, and what are these septas? These septas are nothing but the intermuscular septas. What are these? These are called as the intermuscular septas. Okay, this intermuscular septas divides the entire thigh into three compartments. So this compartment is called as the anterior compartment, which is also called as the extensor compartment. Okay, so this is also called as anterior compartment or extensor compartment. Why it is called as anterior or extensor compartment? Because it is going to extend the knee. Okay, it is going to extend the knee. So since it causes extension of the knee, it is called as extensor compartment. The medial side is called as the medial compartment or the adductor compartment. This is called as the medial compartment or the adductor compartment, and the posterior compartment is called as the flexor or the hamstring compartment. Flexor or the hamstring compartment, which is nothing but the posterior compartment. So how many compartments are there in the thigh, guys? So there are 3 compartments. You got the anterior compartment, you got the medial compartment, and you got the posterior compartment. So you got 3 compartments. Okay, see, if you see the thigh here, okay, if you see the thigh here, so there is a big muscle which is running across the thigh from the lateral to the medial aspect. Okay, from the lateral to the medial aspect, I can see a big muscle which is running across the thigh like this. So this muscle is nothing but the sartorius muscle. So what is this muscle? This muscle is nothing but the sartorius muscle. Okay, this muscle is nothing but the sartorius muscle, which is running across the entire thigh. It is the longest muscle in the body. It is the longest muscle in the body, and I hope you know where the sartorius takes its origin. It takes its origin from the anterior superior iliac spine. It takes its origin from the anterior superior iliac spine. Now when I make a cross section of the thigh, approximately in the mid thigh or little bit low, the sartorius is more on the medial side. It is more on the medial side. So if I see a muscle on the medial side in the anterior compartment, so this muscle will be the sartorius muscle. So what is this muscle? This muscle will be sartorius muscle. This muscle will be sartorius muscle. Okay, so when you take the sartorius out, you see the rest of the muscles of the thigh, which are called as the quadriceps femoris muscle, which are called as quadriceps femoris muscle. Quadriceps means what? Quadriceps means 4. It has got 4 heads. The 4 heads of the quadriceps femoris are rectus femoris. Okay, so rectus femoris, which is occupying the front of the thigh. It is running straight down. Rectus means straight, so it is running on the anterior aspect of the thigh straight down. So that is called as rectus femoris. You have got rectus abdominis, you have got rectus muscle in the neck region. So all of those muscles are muscles which run straight. Okay, so this rectus femoris also running straight here. So there is another muscle which takes origin from the lateral lip of linea aspera. Okay, so what is this? This is the lateral side. So from the lateral lip of linea aspera, you have a muscle which takes its origin. The muscle which takes its origin from the lateral lip of linea aspera is nothing but the vastus lateralis muscle. Is nothing but the vastus lateralis muscle. So what is this muscle? This muscle is vastus. This muscle is vastus lateralis muscle. This muscle is vastus lateralis muscle, and there is a muscle which takes origin from the medial lip of linea aspera. Okay, so the muscle which takes origin from the medial lip of linea aspera is nothing but the vastus medialis muscle. So what is this muscle? This muscle is vastus medialis muscle. So this muscle is called as vastus medialis muscle. So this is vastus medialis muscle. So this is vastus medialis muscle, and there is a muscle which arises from the anterior and lateral surface of the femur. Okay, so there is a muscle which arises from the anterior and the lateral surface of the femur. So the muscle which arises from the anterior and lateral surface of the femur is nothing but the vastus intermedius muscle. So this is vastus intermedius muscle. This is vastus intermedius muscle. Okay, so now you saw there are 4 muscles in the thigh region. Okay, so the 4 muscles in the thigh region are called as quadriceps femoris muscle. It has got rectus femoris, it has got vastus lateralis, it has got vastus medialis and intermedius. Their origin is very simple to study in this. Vastus lateralis takes origin from the lateral lip of linea aspera. Vastus medialis takes origin from the medial lip of linea aspera. Vastus intermedius takes origin from the lateral surface and from the anterior surface of the femur. Okay, from the femur, from the shaft of the femur. Okay, so this is about the origin of these muscles. The one muscle what we haven't seen here, their origin is the rectus femoris muscle. And rectus femoris muscle, guys, please remember. Okay, so we are talking about, okay, we are talking about the muscles of the front of the thigh, muscles of the front of the thigh. So the muscles of the front of the thigh are, we have seen about the sartorius muscle. Okay, we have seen about the sartorius muscle. We are seeing mainly the quadriceps femoris muscle here. We are seeing about the quadriceps femoris muscle here, and this quadriceps femoris muscle has got 4 components in it. One is called as rectus femoris, one is called as rectus femoris. Next one is called as vastus lateralis, vastus lateralis. The next one is called as vastus intermedius. vastus intermedius. The next one is called as vastus medialis. Next one is called as vastus medialis. Next one is called as vastus medialis. So please remember here, vastus lateralis, vastus intermedius, and vastus medialis and rectus femoris are part of quadriceps femoris. We have seen the origin of these three muscles. Now rectus femoris has got two heads, guys. It has got a straight head. It has got a straight head, and it has got a reflected head. It has got a reflected head. Okay, it has got a straight head and it has got a reflected head. Straight head arises from anterior inferior iliac spine. Straight head arises from anterior inferior iliac spine. A reflected head arises from an area above the acetabulum. Area above the acetabulum. Okay, it arises from the area above the acetabulum. We have seen both this in the earlier sessions itself. Just if you go back to the morning session, when we started the class, I told you about this two spines, that is anterior superior iliac spine and the anterior inferior iliac spine. Here you can see the anterior inferior iliac spine is giving origin for this muscle, which is called as the straight head of rectus femoris. So how many head rectus femoris has got? Rectus femoris has got two heads, guys. One is called as the straight head, another one is called as the reflected head, another one is called as the reflected head. So we have seen about the straight head of rectus femoris in the morning itself. I don't know how many of you have got this point. So this is straight head of rectus femoris, which is arising from anterior inferior iliac spine. And when you see this area, guys, when you see this area just above the acetabulum, below the inferior gluteal line, is the area where you get the origin of the reflected head of rectus femoris. So anterior inferior iliac spine gives rise to straight head of rectus femoris. Area above the acetabulum gives rise to the reflected head of rectus femoris. Reflected head of rectus femoris. Okay, so that is why only when you study the osteology like this, you can able to understand easily where the muscle takes its origin. So now if you see the rectus femoris has got two heads. So the two heads are, one is called as a straight head, another one is called as a reflected head, and I hope you understand the origin of these muscles. Okay, so this is how the quadriceps femoris take their origin, and finally they all get inserted into the patella. So they all gets inserted into the patella. Insertion of the quadriceps femoris muscle is into the patella, and from the patella you get a ligament called as ligamentum patellae. You all know that ligamentum patellae goes and gets attached to tibial tuberosity. It goes and gets attached into tibial tuberosity, guys. Okay, so all the quadriceps femoris muscle, they goes and gets inserted into this bone. What is this bone called as? This bone is called as patella. From the patella you can see a ligament, an important ligament in the knee region, that is ligamentum patellae, which goes and gets inserted into this bone. This bone is called as tibial tuberosity. Now when this muscle crosses the patella, goes and gets attached to the tibial tuberosity, when it contracts, what is it going to do? When it contracts, it causes an important function. So the action of the quadriceps femoris, is extension of the knee joint, and all these muscles are supplied by, what is the nerve supply for quadriceps femoris? Very simple, the nerve supply for quadriceps femoris is femoral nerve. Okay, it is by femoral nerve. Femoral nerve is a branch of lumbar plexus. Okay, it is a branch from the dorsal division of the ventral rami of the lumbar plexus. So it is from the lumbar plexus. Okay, so femoral nerve arises from the dorsal rami, or the dorsal division of the ventral rami of the lumbar plexus. Okay, so this nerve supplies the quadriceps femoris muscle, and when the muscle contracts, it causes the knee extension. Okay, now if you see the patella, okay, if you see the ligamentum patellae, okay, so when you tap the ligamentum patellae, okay, so you elicit a deep tendon reflex. Guys, can anybody tell me what is the deep tendon reflexes which is elicited by tapping on the ligamentum patellae called as? Anybody? When you tap the ligamentum patellae, you get deep tendon reflexes. Very good, guys. This is called as knee jerk. knee jerk. This is called as knee jerk. Okay, so this knee jerk has got root value L2 and L3, guys. This knee jerk has got root value L2 and L3, guys. Okay, so this is about the knee jerk. This is about the clinical application of the quadriceps femoris muscle, okay, which is getting inserted. So at this junction you should know, and you should also remember about one more important thing. Patella. Patella is what bone? Patella, it is arising in the quadriceps tendon. So this patella bone, when it arises in a tendon, it is called as the sesamoid bone. It is called as sesamoid bone. Okay, this sesamoid bone is devoid of, is not covered by, usually when you take sesamoid bone, these bones are devoid of periosteum, guys. It is devoid of periosteum. So remember, any bone in the body, if it is a sesamoid bone, it is not covered by the periosteum. Usually a bone is covered on its outer aspect. Usually a bone is covered on the outer aspect by periosteum, but sesamoid bones are not covered by periosteum. This is one important message here. Always a sesamoid bone will develop in a tendon. I hope you know one more sesamoid bone in the wrist region. Yes, anybody? One more bone or one more sesamoid bone in the wrist region, guys. What is that bone called as? Yes, pisiform. Very good, Anashwara. Very good, Muga. And what is the another bone which is seen in the gastrocnemius tendon called as? So there is one bone, okay, behind the knee, which arises in the gastrocnemius tendon. So sesamoid bone in gastrocnemius tendon. Gastrocnemius tendon. Can anybody tell me what is the name of the sesamoid bone which arises in gastrocnemius tendon called as? That is called as fibula. That is called as fibula. So fibula is a sesamoid bone. Patella is a sesamoid bone. Okay, patella is a sesamoid bone. Okay, and it is also pisiform is also an sesamoid bone. Yes, Anashwara, patella has no osteoblast. No, it is not like that. Okay, see, apart from the periosteum, when the bone is forming within the bone, you obviously have osteoblast. Okay, periosteum is a source of osteoblast, but it is not the only source of osteoblast. Okay, so obviously a bone cannot develop without an osteoblast. So periosteum, it is the outer covering. Yes, accepted. It is a layer which has got osteoblast, but within the bone also you have got osteoblast. Okay, so the blood supply which is reaching the bone will carry the osteoblast to the bone. So patella has got osteoblast. Okay, so I think your doubts is clear, Anashwara. Yes, fine. So with this we are done with the quadriceps femoris muscle. Okay, so we are done with the quadriceps femoris muscle. Next muscle which you come across here is the sartorius muscle. Okay, is this sartorius muscle? Fine. See, this sartorius muscle, we have already seen the origin of the sartorius muscle. It is a very long muscle. It arises from the anterior superior iliac spine. It arises from the anterior superior iliac spine. Okay, you can see here it arises from the anterior superior iliac spine, and where it gets inserted, it runs across the thigh, goes to the medial side of the thigh, and it gets inserted into the, okay, so it gets inserted into the proximal aspect of the tibia. Okay, it gets inserted into the proximal aspect of the tibia. So sartorius insertion is on the medial side, is on the medial side of the proximal tibia. It is on the medial side on the proximal tibia. Okay, it is on the medial side of the proximal tibia. So if you take sartorius muscle, it is a muscle which is running across the entire thigh and gets inserted here. When it gets inserted here, along with this there are two more tendons which are getting inserted here. The tendon which is getting inserted behind the sartorius is called as the gracilis tendon. This is called as gracilis tendon, and the tendon which is getting inserted behind the gracilis, this tendon is called as the semitendinosus tendon. This is called as semitendinosus tendon. So what is this? Sartorius. Okay, this is sartorius, gracilis and semitendon. They all gets attached at one common point, that is on the proximal tibia on the medial side. Okay, I will just give you a question here. So there is one interesting bursa which is present here, which is separating these insertions. So there is a bursa which is separating these insertions. Can anybody tell me what is this bursa? So you have got lot of bursas around the knee joint. There is one interesting bursa which can get often inflamed. I don't know how much of this is taught in the UG. So there is an interesting bursa which is present here, separating the insertion of these muscles. Yes, anybody, what is this bursa called as, guys? This bursa, what you see here, This bursa what you see here is called as the pes anserinus bursa. It is called as pes anserinus bursa. It is called as pes anserinus bursa. Okay, so this bursa what you get is called as a pes anserinus bursa. Pes anserinus bursa, when it gets inflamed, it results in pes anserinus bursitis. Pes anserinus means it is like a foot of a crow foot appearance. Can anybody tell me pes anserinus appearance is seen in one more area of the head and neck region? I have already given a clue. Pes anserinus is also seen. Pes anserinus kind of division is also seen in yes, very good Shanmuga, very good Muga. It is facial now. Very good, excellent guys, excellent. It is also seen in the pes anserinus term is also seen in facial now. Excellent Snega, excellent Muga. Yes, very good guys. So this is about the pes anserinus bursa, which is separating these muscles in this region. Okay, so when you talk about sartorius muscle, the sartorius muscle is supplied by, okay, so sartorius muscle is supplied by, the nerve supply for the sartorius is the femoral nerve guys. It is the femoral nerve, and the action of the sartorius is it acts as an flexor of the hip joint. It acts as an flexor of the hip joint. Okay, it acts as an lateral rotator of the hip joint. It acts as an lateral rotator of the hip joint. Lateral rotator of the hip joint. It also causes extension of the knee joint. It also causes extension of the knee joint. It also causes extension of the knee joint. Okay, so when your hip goes in for flexion, external rotation, and when the knee goes in for flexion, okay, so this action is produced by the sartorius muscle guys. This action is produced by the sartorius muscle. Please remember guys, sartorius muscle is also called as Taylor's muscle. Okay, so it's also called as Taylor's muscle. Okay, sartorius is also called as Taylor's muscle. Okay, so sartorius is also called as Taylor's muscle. It is also called as Taylor's muscle. So whenever you ask about sartorius, Taylor's muscle, Boxer's muscle, what is called as Boxer's muscle is, since it is starting with S letter, Boxer's muscle. Yesterday we saw about Boxer's boxing action. Very good. It is serratus anterior guys. It is serratus anterior. So sartorius is also called as Taylor's muscle, and serratus anterior is also called as Boxer's muscle. Is also called as Boxer's muscle. Okay, it's also called as Boxer's muscle. Okay. Okay, can anybody tell me what is the main muscle that helps in climbing? What is the main muscle that helps in climbing when you are going to climb an hill? Okay, when you hold the ropes and when you climb, what is the main muscle? Yes, it is latissimus dorsi muscle. Very good guys, it is latissimus dorsi. It is latissimus dorsi. Okay, when you are going to take push-ups, okay, so we are talking about pull-ups now. So when you take pull-ups, so it is the latissimus dorsi which helps. When you take push-ups, what is the muscle that helps in taking push-ups guys? Okay, so the main muscle that helps in taking push-ups is the pectoralis major muscle. It is the pectoralis major muscle. Okay, so just keep these things aside. Sartorius muscle is called as Taylor's muscle. Very important point is sartorius muscle is one muscle which crosses two joints in the body, similar to rectus femoris, which again crosses two joints in the body. Okay, so we'll just add this point here. So a muscle which crosses two joints in the body. Muscle which crosses two joints in the body. Okay, in the thigh region, what we have seen is one is sartorius. It crosses the hip joint and the knee joint. Next is rectus femoris. Which crosses the hip joint and the knee joint. There are a lot of muscles guys. Just to add another muscle here, that is biceps brachii, which again crosses two joints. Okay, it crosses the shoulder joint and the elbow joint. So these are all certain muscles in the body which crosses two joints. Okay, and they act on these two joints also. Sartorius acts on the hip joint and knee joint. Rectus femoris also helps in causing flexion of the hip joint. Okay, so they also causes flexion of the hip joint that you need to understand here. Okay, so these are all the muscles in the anterior aspect of the thigh region. Okay, so in the anterior aspect of the thigh region, we have seen about the quadriceps muscle, and we have seen about the sartorius muscle. Okay, and we have seen about their actions also. Okay, so now what are the nerve supply on the anterior aspect of the thigh? When you come to this compartment guys, always remember, whenever you have a compartment in the thigh, each compartment will have its own nerve supply. They will have their own blood supply. Okay, they will have their own blood supply. and they will also have their own set of muscles within them. Okay, so what is the nerve supply for the anterior compartment of the thigh? So the nerve supply for the anterior compartment of the thigh is the femoral nerve. So this is, let us consider the femoral nerve. Okay, so this is femoral nerve. Femoral nerve is the nerve of the anterior compartment of the thigh. Only 2 points about femoral nerve, guys. Okay, I am not taking much of the time for femoral nerve. Just understand what is femoral nerve. Okay, so if you take femoral nerve here, so femoral nerve is a branch, okay, of the lumbar plexus. It is a branch of the lumbar plexus. As I already told you, it is a branch of the lumbar plexus. It is arising from the dorsal, okay, it is arising from the dorsal division of the ventral rami of the lumbar plexus. It is arising from the dorsal division of the ventral rami of the lumbar plexus. It has got root value L2, L3 and L4. It has got root value L2 and L3 and L4. It is divided into two branches. One is called as an anterior division. Another one is called as an posterior division. Okay, so if you take anterior division contains less muscular branches and more cutaneous branches, whereas posterior division contains more muscular branches and less cutaneous branches. Okay, so if you see the anterior division of the femoral nerve, it has got one muscular branch. Okay, it has got one muscular branch, and the muscular branch which is supplied by the anterior division is to the sartorius muscle. It gives two cutaneous branches. And these two cutaneous branches are, one is medial femoral cutaneous nerve of thigh. Okay, it is called as medial femoral cutaneous nerve of thigh. Another one is called as intermediate femoral cutaneous nerve of the thigh. Another one is called as intermediate femoral cutaneous nerve of the thigh. So if you take anterior division of the femoral nerve, only one muscle, it supplies just only one muscle, guys. It supplies only one muscle. Okay, so that muscle is sartorius, and it gives two cutaneous. So that cutaneous are the nerves which supplies the anterior aspect of the thigh and the medial aspect of the anteromedial aspect of the thigh. Okay, so when you take the posterior division of the femoral nerve, this posterior division of the femoral nerve has got only one cutaneous branch. Okay, it has got only one cutaneous branch, and that cutaneous branch which arises from the posterior division is nothing but the saphenous nerve. This is nothing but the saphenous nerve, the longest cutaneous nerve in the body. Saphenous nerve. Okay, saphenous nerve, the longest cutaneous nerve in the body, guys. So it arises from the posterior division of the femoral nerve, and there are multiple muscular branches. Okay, multiple muscular branches to the quadriceps femoris muscle. So to the quadriceps femoris muscle, you get multiple branches here. Okay, so from the posterior division, you get only one cutaneous branch. Okay, and get multiple muscular branches for the quadriceps femoris muscle. So if you take the femoral nerve has got an anterior division and posterior division, and they supply these muscles. And also remember, you have the trunk of the femoral nerve, guys. So let us consider this is the trunk of the femoral nerve. From the trunk of the femoral nerve, it has got two supply. Okay, so from the trunk of the femoral nerve, this femoral nerve supplies iliacus muscle. It also supplies pectineus muscle. So from the trunk of the femoral nerve, pectineus muscle and the iliacus muscle receives their nerve supply. So this is about the femoral nerve in short. Okay, so we have done with the anterior aspect of the thigh. We have seen about the muscles. We have seen about the regions of the anterior aspect of the thigh. Okay, to complete the anterior aspect of the thigh, we need to look into, or we need to understand one more area in the anterior aspect of the thigh, that is called as the adductor canal or the femoral canal, guys. So we will just move to the next topic, that is the adductor canal or the femoral canal. Guys, see, this adductor canal is also called as yes, guys. Can anybody tell me what is the other name for adductor canal? There is a famous surgeon. In his name, this canal was discovered. He discovered the canal. Is called as Hunter's canal. John Hunter is the surgeon. So this is called as Hunter's canal. Okay, so when we were studying anatomy in the first year, I don't know that there is a person called as John Hunter who discovered this canal. I thought that the hunters used to strike the bow into this area so that the animals will die when they hit this area. That is what my thought process during those days. But later, when we did post graduation, when we studied the history in detail, we came to know that there is a good surgeon called as John Hunter who discovered this canal. And in this canal, you got all the important vessels going through a narrow area. And if you want to put a tourniquet, or if you want to compress this region, you can compress the femoral vessels easily in this. Okay, so that is the importance of adductor canal. Okay, so leaving the history aside, when you see the adductor canal, what is the extension of the adductor canal is? Okay, so you will see about adductor canal. Yes, adductor canal. What is the extension of the adductor canal? So adductor canal, it is extending from. It is extending from. Okay, it is extending from the apex of the femoral triangle. It is extending from the apex of the femoral triangle. It is extending from the apex of the femoral triangle to the hiatus of the adductor magnus, to the hiatus of the adductor magnus. In the adductor magnus, you have got various hiatus. So the last hiatus is called as the adductor hiatus. So the hiatus magnus, the adductor magnus has got an hiatus at the last. So this is an extension between these two. So the adductor canal is an extension between, or it is a canal extending between the apex of the femoral triangle to an opening in the adductor magnus muscle. That opening is called as the adductor hiatus. That opening is called as a adductor hiatus. Now, what is the exact boundaries of this adductor canal? If you want to understand this boundary, again, it is better to make a cross section so that you can understand this boundary very clearly. Okay, so if you want to make a cross section here, I am not going to draw all the layers, just will directly go to the bone. So this is the femur bone. Okay, this is the femur bone. So you get a thickening in the posterior aspect, that is the linea aspera. Okay, linea aspera, and you get the septums here. Okay, so this is the lateral intramuscular septum, this is the medial intramuscular septum, and this is the posterior intramuscular septum. This is the posterior intramuscular septum. I hope you know that there is a muscle which is arising from the medial lip of linea aspera and forming or covering the medial aspect of the femur like this. Can anybody tell me what is the name of the muscle which arises from the medial lip of linea aspera? This is the anterior compartment, guys. This is the anterior compartment. So when it is an anterior compartment, what is the muscle? Very good, guys. It is vastus medialis. It is vastus medialis, guys. So this is vastus medialis. This is vastus medialis. And okay, in the posterior, when you go posteriorly, that is the medial compartment, you reach the medial compartment, and in the medial compartment you get the adductor muscles, and the main adductor muscle what you see here is the adductor magnus and the adductor longus muscle. Okay, so you get two muscles here. This muscle what you see here is the adductor longus muscle, and what you see here is the adductor magnus muscle. This is adductor magnus muscle. Okay, this is adductor magnus muscle. So what you see here is the adductor longus, and what you see here, a big muscle in the medial compartment, is adductor magnus muscle. Now these two muscles, the vastus medialis and the adductor muscles, are connected by a fibrous sheath here. Now this area, okay, okay, what you see here forms, sorry guys, okay, so this area what you see here, okay, is called as, okay, it is called as the adductor canal, so that shaded area is called as the adductor canal. So now over the roof of the adductor canal there is a muscle which is sitting here. So the muscle which is sitting over the roof of the adductor canal is nothing but the sartorius muscle. So this muscle is called as the sartorius muscle. This is called as a sartorius muscle. Okay, this is called a sartorius muscle. Now when you look into the adductor canal, there are certain boundaries here. No, so what are those boundaries? The boundaries which are forming the adductor canal are the anterolateral boundary. The anterolateral boundary is formed by the vastus medialis muscle. The posterior boundary for the adductor canal is by the adductor longus, and by the adductor magnus muscle, So these are all the boundaries of what? These are all the boundaries of the adductor canal, also called as the Hunter's canal, So these are all the boundaries of the adductor canal or the Hunter's canal. And what is the roof formed by? The roof is formed by the fibrous sheath extending between these two muscles. okay, and over the roof you also have the sartorius muscle. We will also have the sartorius muscle. Below the sartorius muscle you have got a plexus of nerves. Okay, so the plexus of nerves which are present in the roof is called as the subsartorial plexus. This is called a subsartorial plexus. This is called as the subsartorial plexus. Okay, so when you take the boundaries of the adductor canal, okay, the adductor canal is bounded on the anterolateral aspect by vastus medialis. So vastus medialis, and on the posterior by the adductor longus and adductor magnus, and on the medial side by the sartorius muscle, and on the medial side by the sartorius muscle, which is actually forming the roof of the adductor canal. Below the sartorius muscle you see a plexus of nerves. That plexus of nerve is called as the subsartorial plexus. Okay, now if you see this canal, this very important canal, two important vessels runs in this canal. The one important structure which runs here is the femoral artery, and the other important structure which runs here is the femoral vein, and you got lot of nerves which are running in this. Okay, we have got lot of nerves which are running in this, and now we will see about the contents of the adductor canal. Okay, so what are the contents of the adductor canal, guys? Yes, contents of the adductor canal are: one, it is femoral artery, and this femoral artery gives a branch in the adductor canal that is called as the descending genicular branch. That is called as the descending genicular branch. Genicular means knee. Genicular means it is the joint. Okay, it goes to the joint, it goes to the knee joint. It is called as descending genicular branch. It is called as a descending genicular branch. Next you have the vein. What vein it is? It is the femoral vein which is seen here. You got number of nerve plexus here. One such nerve is the saphenous nerve. You get saphenous nerve here. You get the nerve to vastus medialis here. You get the nerve to vastus medialis in the canal, and you will also get the branches of obturator nerve here. You also get the branches of obturator nerve here. These are all the contents of the adductor canal. Okay, these are all the contents of the adductor canal. Okay, these are all the contents of the adductor canal, guys. So all these contents are important. Questions comes in this area. What are all the structures which are present in the adductor canal, except they can ask you. Okay, so the contents of the adductor canal are: one is femoral artery. In the femoral artery, when it runs, it gives the last branch. Okay, descending genicular branch is the last branch of femoral artery. Remember, guys, it is the last branch of femoral artery before it enters into the adductor hiatus and become popliteal artery. So this is the last branch, guys. Femoral artery gives descending genicular branch. Next comes the femoral vein, saphenous nerve, nerve to vastus medialis, and branches of the obturator nerve are the other branches which are seen in this area in the adductor canal or the Hunter's canal. Okay, guys, clear? I hope you are clear with this. So we have done with the adductor canal or the Hunter's canal. We have seen about the formation, and we have seen about the contents of the adductor canal. Okay, so I have also told you about the applied aspect of the adductor canal. If you want to occlude the vessels, here they lie close to the bone, so if you put a tourniquet in this level, you can effectively compress the vessels so that you can do amputations in the lower part of the limb, maybe in the leg region or in the foot region. So this is one area where the vessels are close to the bone, so you can easily tie them with a tourniquet. So that is the applied aspect of the adductor canal. Okay, so I hope you understood the basics of the front of the thigh, femoral triangle. See, all these are very important areas: femoral triangle, femoral sheath, and the contents of the femoral canal, femoral ring are all important areas. Frequent questions comes from this area. Understanding of these areas are very important. Okay, so with this we'll take a short break, guys, and we'll resume after 10-15 minutes with the next part of the lower limb. Okay.